Welcome everybody. This is Dr. Shanmugapriya, your PrepLadder faculty for biochemistry. And if you're a person who has written the latest NEET PG 2025 exam, and if you're in the anxious wait for the results, then this is the session for you. Because in this session, we will be discussing about how competition has evolved in NEET PG examination, how to find out what your score can be based on the corrects and the incorrects, how to translate the score into a possible or predictable rank for you. Based on the rank, what is the seat and what is the college that you can expect. Not just that, I would also assure you, if you stay with me till the end, I will give you two pieces of good news, which will help you to think laterally and which will help you to get a sigh of relief, from the anxiety that you've been all along. Okay, so two pieces of good news are awaiting based on the score and the rank. Okay, and at the end, if you think that the score and the rank is not as you expected, then what is the way forward, right? That will also be discussed in this session. Okay, so this is about what you can expect in this session. Now let's start with the competition. Right, as you can see in this graph, starting from 1.6 lakhs candidates who attended the 2020 NEET PG exam, in 2025, 2.42 lakh candidates have appeared. Does this mean it's a bad news for us? Because there has been a 50% increase in the number of candidates who have appeared. Actually, this is not a bad news, okay? Because I'm going to give you only good news today. Why is it not a bad news? Because there has been an increase in the number of seats. From 31,185 in the year 2014, now we are at 7,311 in 2023 to 2024. Actually, in 25, there had been further increase of 1,000 seats. So if you look at this statistics, right, we have 74,306 seats as on April 25 versus 48,118 in the year 2021, which means there has been a 50% increase in the number of seats as well. Okay, which means you don't have to feel anxious. You don't have to be on a self-sympathy mode stating that I am in a bigger competition than my seniors, right? Whatever they had been facing, you're facing now. That's it. But there is a good news here. The good news is if you compare 74,306 with 2.4 lakh students, it means 1 in 3 candidates will get the seat. Do you all understand this? Yes, I will tell you all about that. You don't worry, Ved Guru. Yes, 1 in 3 candidates can get a seat. It sounds very optimistic, right? But I also agree that the reality is not as sweet as this. Why isn't the reality so sweet? It is because all of us fight, right? All of us compete for those sought after PG seats, those very few sought after PG seats, those very few colleges, right? So what I would want all of you here to think is, let me tell you this, not everybody should get into radio diagnosis to be successful in life, right? Not everybody should get into dermatology to be successful in life. You don't have to be a surgeon to be successful in life. Do you all understand that? So my recommendation for all of you here is, you carve your own path, okay? You be a pioneer. You carve your own path. You be a king. You be the queen of that path. Choose a particular course which is not very sought after based on the passion that you have for that subject, right? And if you can prove yourself in that field, my assurance to you is that you will be the king, you will be the queen. Instead of competing in this crowded place, right, find out your own path, because 1 in 3 candidate will get a seat. That is a seat for you, okay? So that is one piece of good news that I have for you. And having understood this competition evolution over years, okay, let's try to understand few facts about cutoffs, right? So there are two types of cutoffs. One is qualifying cutoff, the other one is admission cutoff. Qualifying cutoff, as you know, is the minimum percentile that is specified by NBE for you to be eligible for this. We are least bothered about this qualifying cutoff, primarily because though NBE releases the initial cutoff, what happens is frequently it is revised downwards, right, by the Ministry of Health, because their primary aim is to fill up all vacant seats. In 2023, the qualifying cutoff was 0 percentile. So let's not even worry about this qualifying cutoff. We are only worried about the admission cutoff, which is the minimum score that a person should get to get a seat. right? So what are the determining factors for admission cutoff, which frequently keeps changing year on year, right? So there are two factors which determine the admission cutoff. One is, as we discussed, the competition. The other one is the level of difficulty of the paper. Because before I joined, I saw that in the live chat, many of you were asking each other, how do you think about this paper? Is it an easy paper? Is it a difficult paper? Because based on that, the cutoff is obviously going to change. Okay. Now, already we have demystified the first one, competition. Though we know more the number of aspirants, tougher will be the competition, higher will be the cutoff. I've demystified that, stating that though there is an increase in the number of candidates, number of PG seat has also increased, so you don't have to worry about it much. When you come to exam difficulty, right, obviously easy paper meaning higher cutoff. You will have to score higher to get a particular PG seat if the exam paper is easy. Okay, now let's try to understand. Showed wrong last time. We have tried doing it the best this time. Okay, so try to watch this. Yeah, I will tell you how the ranks are predicted. That is why I have this session today. Yeah. Yes, we will be discussing about the Dr. Sivaranjani. So how has paper evolved all these years? Okay, so look at this. This is the pattern that we have observed. The pattern obviously is the number of clinical case-based MCQ, the number of image-based MCQ, conceptual MCQ, the proportion has significantly increased. Okay, there is no serial increase or serial, there is no pattern in the way it has increased, but overall the number of clinical image-based integration MCQs have increased over the years. Okay, difficulty part, that is where there is an interesting observation that I have for you. Okay, as far as the difficulty part is concerned, 2021 and 2024 were two difficult question papers. And 2023, though there were many repeats, clinically they asked many difficult MCQs. Okay, so with this observation, 2022 was easy, right? With this observation, if I ask you, what do you think about rank 1 score for all these years? You would think 2022 rank 1 score should have been higher, right? 2023 rank 1 score should have been low. Okay, but what do you observe here? Yeah, can you see that in 2022, we expected a higher rank 1 score, but in reality, it was 705. 2023, the most difficult question paper, it has the highest rank 1 score of 725. So what is your inference here? Your inference here is high rank scorers, okay, the level of difficulty does not determine their score, does not determine their ranks. Okay, so the first 500 ranks, cutoff has not changed over a period of year. Okay, be it a difficult paper or easy paper, the first 500 rank has not changed at all. Can you see that here? Yeah, for the first 500, there has been no change in the rank that they have scored. It has been always around 590. No, always around 630, that first 500 gets over. Only after that, there is a change. And the changes as expected in 2023, for the same score that a person has got, the rank was lesser. The person has been able to move ahead even when the score that the person got is the same as the previous year. Okay, which means tougher question paper meaning higher, tougher question paper meaning lower cutoff. Okay, so this holds good after 500 ranks. So based on such assimilations, based on such predictions, we have a prediction for 2025 also. Do you understand this? So for 2025, what is our observation? We have continued with the same 200 questions, 800 marks, right? Time-bound sections. This year, there is no normalization because it is only one shift. The paper was easy. Yeah, many previous year topics were asked, but among choices, there were twists, right? So again, who might make mistake here? Only those who are not very clear, right? So the moderate readers are not very clear might get confused with the number of choices, with the twist in the choices. But what do you think about the rank 1 score? The rank 1 score will be higher than what has been happening so far. So last year, if it was 725, this year, my prediction is it will be around 740. Okay, rank 1 score should be around 740. And from there, what do I expect for the other ranks? This is my prediction. Okay, so the first 100 ranks will get over by 675. Okay, and then 500 by 650, 1000 by 635. Okay, so 2000 ranks will get over at around 620 marks. Okay, so if you think you can score above 620 marks, then your rank will be better than 2000, which means you have all choices. You want radio diagnosis, you can take. You want dermatology, you have it. You want general medicine, you can take it. Pediatrics is available. So till 2000, till 620, you have all choices. Okay, and then for 5000 rank, it is still 600. Until 5000, you have choices including dermatology and general medicine. This I'm telling at the end of the third counseling. Okay, third round of counseling. Dermatology, general medicine will be available till 5000 ranks. And then till 9000. If you have scored till 575, you are expected to get around 9000 rank. If you score around 9000, then you still have choices of pediatrics and OBG. Pediatrics gets over early, OBG gets over a bit late. Till 10,000, you can expect OBG. Okay, then 550 to 575, that will be till 14,000 rank. And till this, you have clinical courses, right? You can take respiratory medicine, you can take ortho, you can take surgery, you can take ENT, ophthal, emergency medicine. So all these will be available till 20,000 ranks. Okay, so for 20,000 rank, the mark has to be 525. So below 20,000 rank, then it becomes paraclinical and preclinical courses. And you can also try getting it in private medical colleges or peripheral colleges. But clinical courses, very rare for you to get below this rank, right? So this is the prediction that I have for the mark and the rank for this year. Okay, you got 500 last year and rank was 23,000. Okay, so you got 500 and your rank was 23,000, and you're saying this I have underestimated. Let's see what happens when the results come out. But in and around, this is how it is going to be. The prediction is expected to be around this level. Okay, so I hope I've clarified what is the mark and what is the rank that you can expect. If you're weak in PSM, then you're definitely getting MD PSM. That's the irony that happens many a times, but it is all about how you want and what you want, right? It's all about taking choices. When you make choices, you have to be very clear about, please listen to this. Don't make choices based on what others tell you is sought after, right? Don't make choices based on what others have told you will give you the enough money, right? It should not be based on how you are going to get your life balanced. Okay, it should be purely based on passion. If you're passionate about what you do, right, money follows behind. Okay, if you're very interested in what you do, you will get your balance. You will get the balance in your life. So it should not be based on what others tell you. It should be purely based on what you want, what you like, what your strengths are, what your weaknesses are. Okay, based on that, you make choices, you will be successful. My older hairstyle was prettier. Okay, so yeah, that's a different thing to discuss about. I stopped straightening because I don't want to get into those chemicals, exposure to chemicals. So this is my natural hair and this is how I do. So these are the key shifts that we have observed so far. Very few one-liners these days. There are many integrated application-based MCQs and subject-wise weightage changes. Always 5 subjects, they have the maximum, they pull the heavy weight, right? Starting from medicine, surgery, OG, pharmacology, and PSM. These are the 5 high weight subjects. And what is upcoming now is, thank you. Surgical DNB you can expect after 10,000. Even after, yes, 15,000. With a score around 540, yes, it is possible, Pranam Kapoor. It is possible. Okay. So what is on the rises these days? There are many questions on radiology, microbiology, pathology, and biochemistry. And overall, forensic, ophthalmology, and ENT, we have seen that less number of MCQs are being asked, but this is not a general rule. This keeps changing. Okay. So based on these observations, if you think you will have to plan for NEET PG 2026, okay? So don't think that I've started discussing about the next year when you have not even gotten the result for this year. This is for those who think you won't be getting enough score, you won't be getting enough rank or good rank. It is a time for you to remain motivated, because there is always the next time, and you know how to prepare based on what you have learned all these years, right? So for those who want to plan for NEET PG 2026, your game plan should be centered around these facts. Always think clinically, learn in an integrated fashion. Okay, so come out of the rote learning mode, go beyond theory, practice clinical reasoning, always try to interpret any report that is shown to you, and connect it with basic sciences. Okay, learn basic sciences conceptually and always try to apply it clinically. And yes, you have to practice mock tests. Previous year MCQs mastery is essential. Okay, when I say learn previous year questions, it should not be just memorizing the answer for previous year questions. You should understand the entire concept based on which the previous year question has been asked. The entire topic has to be learned conceptually, so that any twist in the question you will be able to answer. Okay, and focus on high yield topics. I'm not here to say that focus on only high yield subjects. Okay, focus on high yield topics, give equal importance to all 19 subjects, practice MCQs as much as possible, learn from errors. Okay, and as you practice MCQs, as you write mock tests and grant tests, train with sectional timings, because that is the way forward. And what is more important, above and beyond this, is you should learn resilience. Okay, this exam is not your entire life. Your life does not totally depend on all these exams, does not totally depend on the score that you get, or the mark that you get, or the rank that you get now. Okay, this is just an add-on fact in your life that is going to add a cream to your layer. And how good the cream is going to be is based on how good you make your choices. Okay, so make choices based on what you like what somebody said, if you don't like SPM PSM, you will get MD PSM, right? That you can avoid, because you're the one who's going to make all those choices. When you make choices, you're going to choose only what you like. Okay, so learn resilience and stay informed. Okay, thanks all of you for joining NEET PG and chance of quitting it for INI-CET seat without paying bond. Yeah, so you anyway would have attended a few of the rounds of NEET PG by the time, and there are many ways in which you can avoid those ill effects of having to come out of NEET PG, right? So that will be discussed in one other session. Expected result date, we are expecting it probably in the first week of September. Okay, so thank you all. The takeaways for today's session is try to be a pioneer, don't follow somebody else. See the brighter side of the world always. Cutoff changes don't actually happen for the first 500 ranks. So you have to try to be in one of the first 500 ranks, right? So learn clinically, practice MCQs, write mock exams. Okay. Thank you all. Thanks for joining.